Now we are going to start about the vaccination. The vaccination is the process of administering a vaccine to help the body develop immunity to a disease. The vaccine contains weakened or inactive parts of particular disease-causing organism that triggers an immune response, teaching the body to recognize and fight off the disease if encountered later. This is a crucial process in the public health measures that have significantly reduced the prevalence of many infectious diseases. The vaccines can be having the B and T cell responses without overt infection, and they make the protection via immune memory. Immune memory, and having the various type live attenuated, cared, aura, muscular. So first we are going with the live attenuated vaccine. In live attenuated vaccine having the pathogen modified to be less virulent. So we'll start from here. In the description, the microorganism render non-pathogenic but retains capacity for transient growth within the inoculated host. The microorganism render non-pathogenic. The pathogen you are injecting, it is become non-pathogenic due to some modification. Certain live vaccines are MMR, measles, rubella, varicella, and may be given to people living with HIV who have a CD4 cell count greater than 200. In consultation with the specialist in infection disease or immunology. Basically, we are not giving the live attenuated vaccine to the immunocompromised patients like in HIV or AIDS because they're having some risk of infection. But if a HIV patient having the CD4 cell count greater than 200, then we can get live attenuated vaccine. In the supervision of specialist of infection disease department. What is the prawns and crowns? The prawns are induce several and hormonal responses, like they are doing cell-mediated response. And they induce a strong, often lifelong immunity. And what is the contraindication may revert to virulent form. Sometimes the live mistakenly the microorganism did not render not pathogenic qualities and they become more pathogen to the organism or human being, and if given to less than 1 year, the maternal antibody may kill pathogens and contraindicating the pregnancy in the patient with immunodeficiency because in that patient there is risk of infection by these vaccinations. We are having the examples, and for that we are having a mnemonic that the attention teachers, please vaccinate small beautiful young infants with MMR routinely on daily basis. For the A, we are having adenovirus. For the T, we are having typhoid, P polio, then vaccinate varicella, smallpox, small, beautiful BCG, young infants, yellow fever, infants, influenza, and then MMR, mumps and measles, rubella, and we have routinely means rotavirus. So don't forget this mnemonic. Attention teachers, please vaccinate small, beautiful young infants with MMR routinely. And what are example? Adenovirus, typhoid, polio, varicella, smallpox, BCG, yellow fever, influenza with MMR and rotavirus. Understand? Next, we are going to the guilt on inactivated vaccine. The pathogens is inactivated by the heat or chemicals. Maintaining the epitope structure on surface antigen is important for the immune response, mainly induce the hormonal immunity. If you guys remember the structure of antibody, there was one diagram. It's like this. There were antigen binding, and here there was one structure was binding in the diagram, and they mentioned epitope. The epitope is a structure for the recognition of the microorganism that were present. And they mostly use for all the things to recognize a microorganism. That is the epitope. So, What are the pros? What are the pros and the contraindications? It's having the benefits safer than live vaccines. It will less side effects, and they're having the strong hormonal immunity. Hormonal response is strong hormonal response as compared to live attenuated, and they're having the weaker immune response than live attenuated and no risk of infection. It's also a good thing they have no risk because already the microorganisms are killed inside the vaccine. And contraindication because they are the weaker mediated immune response and live attenuated may induce a hormonal response that boosters or shots usually needed. And many of time we are giving them booster shots. After vaccinate, many of them are getting booster doses. And what is example? A trip could kill you. It's in the morning. A trip can kill you. Hepatitis A, typhoid, rabies, influenza, and the polio sac. And one thing more, guys, if you notice, typhoid is also life attenuated and killed inactivated. If the typhoid is given orally, then it will be life attenuated. If it's giving intramuscularly, then it is, remember, then it is inactivated or killed vaccine. Okay. Now we are going to watch subunit, recombinant polysaccharide, and conjugates. Or use specific antigens that will stimulate the immune system. If you guys know there was we have an antigen presenting cells, they always took one of a stimulating thing that recognizes the pathogen, like LPS, polysaccharides, mannose, etc. So these type of things we're using for the vaccinate when injected deep, like mannose or polysaccharides, we are giving that type of proteins into toxin that given, then already that antigen presenting mediate the immune system and that way. What gets vaccine? They are having a target specific epitopes of antigen and lower chance of adverse reaction. And what is a contraindicated? It's a many expensive and having the weaker immune response. And basically we are using them for the hepatitis B virus, human papilloma virus, acellular pertussis, Neisseria meningitis, streptococcus pneumonia. Also they are having the T cell independent responses. If you guys remember, they are having T cell independent responses, and they are having a PCV, PCV15, and PCV20. By the PCV, the pneumococcal conjugate vaccine. Theta, pneumococcal conjugate vaccine. Having a polysaccharide produce T cell independent response, having HPA helper shots. We talk about the toxoid. In the toxoid, there is a denatured bacteria toxin with intact receptors binding SARS, and they stimulate the immune system to make antibodies without potential of causing diseases. They just go and bind with the antibodies and give the response, and they did not cause any disease. They protect against the bacteria toxins. They have a different toxin, toxins, and etc. They haven't got their antitoxin level decrease with the time, so booster dose is needed. In toxoid, we have to need booster dose. Like we are giving in killed or inactivated vaccines. And what are toxoid we are using for the Clostridium tetani, Corynebacterium, Diphtheria. Okay. mRNA, for the mRNA, a lipid nanoparticle flavors mRNA causing cell to synthesize the foreign ball proteins like spike proteins and SARS-CoV-2. So that we are using, and what is SARS-CoV-2? This is the example of mRNA. This is real acute respiratory, severe acute respiratory syndrome. What about the COVID? That is a corona virus 2. And it's a strain of a coronavirus that causes COVID-19, the respiratory illness responsible for the COVID-19 pandemic. That was mRNA vaccine. And what has happened? There's a high efficacy, induced several and hormonal antibodies, and they are saving pregnancy. And contraindication, they are local and transient systematic fatigue, headache, and melancholia, and reactions are common. And they are having the rare myocarditis, pericarditis, particularly in young males. These are about vaccination. But if you guys know, they have different routes. There is the oral and intramuscular. In the oral vaccines, if you guys know, in oral, they are going to stimulate GI mucosal immunity, and they are largely IgA responses. And for example, they are going oral poliovirus and otavirus. And if you are going IM intramuscular, then they will stimulate the tissue response. They are going for tissue response, and they are having large IgG. Okay, well, if you are going any vaccine oral, then it will give largely IgA response. If you're giving any vaccine intramuscular, then it will go IgG response. Understand? And most of vaccines are giving passive immunization. They are giving passive immunization because with administration of antibodies, and they are having the short-term protection in the weeks, no mammalian long-term protection used for dangerous immunity infection like rabies, tetanus, also maternal antibodies like fetus, and sometimes passive and active done simultaneously like rabies, immune dropping plus rapid vaccine. Understand? This is all about vaccination.